Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be doing a slideshow and presenting information on Bupropion. Its brand names would be Wellbutrin or Zyban. Now before I talk about the medication itself and get into the slideshow, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So first off, what will we cover in today's presentation? We're going to talk about how this medication works. We're going to talk about indications, or what the medication is used for, contraindications, or reason the medication cannot be used. We're going to talk about some examples of dosing, as well as some side effects with percentages. So first off, how does bupropion work? Well, it weakly inhibits the neuronal uptake of dopamine and norepinephrine. It does not inhibit monoamine oxidase or the reuptake of serotonin. So now let's touch on indications, or why this medication is prescribed to patients. So we see it used in major depressive disorder, or MDD. We see it used to treat the depression associated with seasonal affective disorder, so it may be used to prevent the onset of depression. And we also see it used in smoking cessation. This medication is actually medication that I use personally, usually starting in about October, leading into the winter months, because I have bipolar depressive disorder. So I use this medication to prevent myself from having a depressed episode through October, November, December, and January. So now contraindications, or reason the medication could not be prescribed to a patient. So first off, if a patient had a hypersensitivity or an allergy to bupropion, they would not be able to use this medication. This medication cannot be used during the abrupt discontinuation of things like alcohol, benzodiazepines, or anti-epileptic drugs, because that may increase the risk of seizure. It cannot be used within 14 days of a monoamine oxidase inhibitor. And it cannot be given to patients who have a diagnosis, whether current or from the past, of bulimia or anorexia. And finally, it cannot be given to patients who have a diagnosis of seizure disorders. Now we're going to touch on some examples of dosing of bupropion. So when the medication is given for major depressive disorder, if a patient was using Wellbutrin XL, the extended release version, then they would use 150 milligrams once daily in the morning for about 3 days, and then if the physician instructs them to, they can increase the dose to about 300 milligrams once daily. The maximum dose in this setting of MDD would be 450 milligrams given as a single dose. Now what about in smoking cessation? So if using the sustained release tablets, a patient may use 150 milligrams once daily for about 3 days, and then increase the dose to 150 milligrams twice daily. It's important here to note that there must be 8 hours in between doses. Now finally, we're going to wrap up the presentation with some side effects of bupropion or Wellbutrin. So first of all, tachyarrhythmia comes in at 10%. Pruritus or itchiness of the skin may fall between 2 and 4% of the time. 3 to 5% of patients may experience a rash, while constipation comes in at a rate of 5% to 26%. 9 to 24% of patients may experience nausea, and arthralgia or joint pain may come in between 1 and 5%. 8% of patients may experience confusion, 6 to 22% may experience dizziness, and 25 to 36% may experience a headache. Insomnia may happen 11 to 40% of the time, and a tremor may happen 2 to 21% of the time. A menstruation disorder or a disorder with your period may happen 5% of the time, and pharyngitis comes in around 3 to 11%. Xerostomia or dry mouth would happen 10 to 27% of the time. Now a couple more rare but serious side effects would be seizure, angle closure glaucoma, mania, or suicidal thoughts. That's all we're going to talk about today with bupropion or Wellbutrin or Zyban. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found this information valuable and you'd like to help grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. And for today, take care.